Welcome, everyone. Thank you all for joining this evening for our October 2024 quarterly meeting. And you all may be the ones that have reminders on your calendar, but we're having trouble sending out emails to our distribution list. So I was only able to send to 1/4 of our distribution list. So hopefully we have people joining us. If you got an email from me, it's because you're at the beginning, the first quarter of the alphabet with your emails. So thank you everyone for joining us today. We're glad that you're here. I think Denise, if you want to, you should have received a message that we're recording the meeting. And we will begin just an overview of our agenda this evening. We're just really providing some updates, and then and we also have a presentation about the Tulsa Birth Equity Initiative with some new news from them. So we're excited to share that with you all tonight. The first item on our agenda, I'm going to turn it over to Lori Esri, who with the Oklahoma State Department of Health, who is going to provide us with an update on the Choosing Childbirth Grant.
Thank you, Barbara. Good afternoon, everyone. This is just a rather informal update this evening because things are not quite finalized for the latest release of funding, but I wanted to share the latest about the Choosing Childbirth Act funding. And before I get into that, though, for those of you who may not know, I wanted to give just a little bit of a history of how the Choosing Childbirth funding came about, and really kind of how it's evolved over the last several years. And then I'll give you an update on where we stand with the notice of funding opportunity that went out in August. So first, the first legislation that passed was all the way back in 2017, for which brought the Choosing Childbirth Act into being. It was House Bill 1703. And with that bill, $2 million of funding was appropriated annually. However, the funding actually really wasn't put in place and released until July of 2019, so FY20. The way that the original legislation was set up, it actually only provided for a grant supervising entity. So OSDH then had to put out an RFP, and there was a competition who would serve as a grant supervising entity. It was very new legislation. A lot of folks didn't know anything about it or really weren't that familiar with it. And so it was a little limited in really who applied. Oklahoma Pregnancy Care Network, which is modeled on Texas Pregnancy Care Network, did win the bid, but they were really the only bidder at the time. And so they set up their network very similar, like I said, to TPCN. And they did it on a very specific model, which was counseling, referrals, concrete supports, and then parent education, which are all positive things for sure. But again, a very restricted model. But we worked with OPCN, they grew, they expanded, and currently they are still funded under the original act. The appropriation did increase to $3 million per year, and they have been the recipient of funding ever since FY 2020. And so they are currently under contract with OSDH, and they serve about 20 different entities, pregnancy care networks, who follow that model, offering, as I said, parent education, counseling, resource concrete supports, and referrals to women and children. And they serve them up to a year. So that was the existing structure. Again, we're honoring the contract that was put in place for that. And so just wanted to share a little bit of that history. So this past legislative session, we had new legislation passed under SB 538. And what that did is it expanded OSTH's ability to award. So not only can we award a grant supervising entity, but we can also now award directly. And then new funding was appropriated. So on top of the $3 million that is part of the annual appropriation, an additional $15 million was added. So a total of $18 million then became available annually under the Choosing Childbirth Act. Because that act is very specific in the way the legislation is written, that it is a grant making provision, we were able, instead of doing an RFP process, which is our normal process, we were able to do a notice of funding opportunity and get out that notice and funding much more rapidly this go around. So we were very excited that we were able to put out a NOFO. So the funding was available July 1st, and we took a very ambitious approach and engaged in a really tight timeline. But we did our town hall July 31st, and we released that funding on August 1st, or I'm sorry, the application for our notice of funding. And so we were really pleased that we were able to get that out. And so so that brings us to present. The applications were due September 11th. And so I am going to let everyone know that we did receive 29 applications, and those applications total asked for just under $64 million in funding. So obviously that's a lot of funding. That's a lot of applicants. And we unfortunately are not going to be able to meet all of those needs and fund everyone. We had a great structure set up of maximum bids, medium bids, and minimum bids. And we had great scoring teams, and we turned those around very quickly. However, because it is a large amount of funding and it was specifically appropriated for grants, our legal team wanted to do a thorough review before we released those notice of awards. So currently, legal is reviewing those applications right now. So even though we were able to kind of really follow our timeline very quickly, we do understand it's a second level of review. We want to be really respectful of everyone who applied. We want to make sure that we do our due diligence, that we follow what we set out to do in our notice of funding announcement, that we are, we said we wanted to hit disparate geographic areas. So, looking at a lot of rural areas, we wanted to make sure that we had multiple services across the state of Oklahoma. One thing that this new legislation also did is it provided for mental health services, which wasn't previously listed under the former legislation. So we had a little bit more expanded opportunities and expanded services. Also, one of the things the new legislation did is expanded care from that child from 1 year of age through 3 years of age. And so, again, we wanted to hit as many of those parameters as possible with all of our applicants. So looking at all of those very carefully. I do believe we should release our notice of awards this month. That's the goal, to get those out and let everyone know who's been awarded and how that funding fell and how the distribution is across the state of Oklahoma. We were very, very pleased with all the applicants we got. We got some great applications. The scoring team did a great job. It was a lot. It was a lot to go through and process. And again, just some really great applications. Very excited that so many folks are serving this population and really, really want to do it well. And so I wish we had the funding to award everyone the full amount that they asked for. Wouldn't that be wonderful? But unfortunately, that is not the case. So again, it is under legal review right now. And as soon as I have legal clearance, we will send out those notice of awards. Even for those who aren't awarded, we will make sure that they are notified as well. Please do keep in mind that since this is kind of a new process for us, the SNOFO process, and it's new appropriated funding, we are only doing a 3-year cycle. So there will be other opportunities moving forward. Also, this is what I share with everyone. We never know what the legislature is going to do, if they're going to offer, open up more dollars, if for some reason someone can't meet their obligations and we have additional funding that comes out later. I mean, who knows? I always say, please stay in touch, stay engaged. We will continue to provide information. You can email me directly, Melanie Gartside, who is also going to be our new coordinator for the program. We set up that Choosing Childbirth email. That is still active, and it will remain active. So you're always welcome. If you are familiar, if you're not familiar with that, I'll make sure that gets posted in the chat to email there as well. And again, my own email and Melanie's. And again, I'll make sure all of that gets in the chat. So that was a really quick kind of overview, and bringing us up to date on where we are with the NOFO process. So I'm happy to answer any questions if anyone has anything specific that they would like to ask. I will try to answer to the best of my ability.
Thank you so much, Lori. So yes, if anybody has a question, you're welcome to come off mute or share your question in the chat. It's exciting. You have a lot of interest in that funding, and we'll look forward to see who are the awardees for that. I think there are probably a lot of them on this meeting, so we appreciate your providing us with that update.
Absolutely. I don't want to miss anything in the chat. Okay.
I don't see anything in the chat.
I don't either. Again, I will put all of our email contacts in the chat, so anyone is welcome, to reach out and email me. The only thing I really can't tell you right now is, where we landed on the scoring team, since it's under legal review. But, we wanted to be very transparent with this process. And so we are definitely trying to do that. And we want to be very good stewards of this funding that the legislature appropriated. And I'm really excited to send out the notice of awards. I'm excited about that. I'm excited about the collaboration that we're going to have moving forward. So again, thank you for letting me just share a little bit about that today.
Well, thank you. We appreciate the update. Okay. Joyce, I believe you are up next with the rest of the OSDH updates.
Right. Thank you, Lori, for the update on choosing childbirth. I know there's a lot of interest, so appreciate the update. And a few other items that we have going on at the State Health Department and with the task force. First of all, we had a perinatal RFP that went out for bid, and that has been awarded. And I'm happy to announce that the Oklahoma Perinatal Quality Improvement Collaborative did receive that award. And so they'll be able to continue their great work in relation to working with birthing hospitals and other healthcare organizations, particularly in relation to maternal and infant health outcomes, including the Preparing for a Lifetime, as well as other initiatives that have included items such as Teen Birth, AIM bundles, and other items. So just something to look forward to, and to congratulate the OPQIC on that award.
Thank you, Joyce.
You're welcome. We were very happy to award it. And we also have some additional awards that we received that we wanted to let everyone know about, because it's additional items that we'll be able to work on. So we did receive the HRSA State Maternal Health Innovation Program Award for the next 5 years. And so we are excited about that. It's for $1 million. And the purpose is to reduce maternal mortality and severe maternal morbidity, and improving access to care that is comprehensive, high quality, appropriate, and ongoing throughout all stages: preconception, prenatal, labor and delivery, and postpartum. This is allowing us to do several innovative practices to enhance state maternal health surveillance and data capacity, and identifying and implementing innovative interventions. Some particular innovation projects that are planned and covered is to continue to expand county health department clinics and mobile clinics for prenatal care and maternity care. So we can have more throughout the state. Our rural areas are in deserts, as many of you know, and so we are trying to provide more access to care in those areas. Also to have an electronic referral warm handoff system for mental health and substance use disorders to behavioral treatment centers. Tribal maternal health projects, so special projects going on there. Group prenatal care for high-risk participants with a substance use disorder. Additional specific innovative projects with the Perinatal Quality Collaborative, such as maternal safety bundles, simulation trainings, and other items. Community health clinics addressing social drivers of health, and services to assure the family voice in maternal and child health programs and projects. So those are kind of items where that award is. So there will be some RFPs coming out related to some of those items stay tuned. We'll get those out to everyone so that all have an opportunity who would like to participate. Additionally, we received from the CDC the Erase Maternal Mortality Award for just under $500,000. And that is really to work with our Maternal Mortality Review Committee in being able to have more timely and relevant data broken down in many different avenues to be able to provide down to specifics. And so we can drill down more into our innovations in those items. It'll allow us to have a family interviewer to really kind of get that qualitative side. So have the quantitative side, but we really need that qualitative side also that you can't get to sometimes from medical records or other records. Additionally, it will include being able to connectivity to various data systems to allow that exchange of information and receiving of information directly, and also practices as well as increased communication and methods of communication to get the recommendations out that come from reviewing those records and looking at what is causing our maternal deaths and how do we improve those, and then get those out so that the action can come from the data received. So that's just a little bit about those items. Just wanted to let you know about those. You'll be hearing more soon. They just started like the first of this month. So more will be coming. And then I wanted to give a quick update in relation to preparing for a lifetime. So I have a few slides for this one. Thank you, Denise and team. So this is Preparing for a Lifetime is Everyone's Responsibility campaign, turned 15 unbelievably this year, which was an initiative started to reduce infant mortality and disparities and improve maternal and health outcomes across the state. And this has had a lot of success. But it was time for a refresh. Information after so many years can become dated. So we worked with our communications division, who was kind of hit out of the ballpark with this one, really did a wonderful job in helping us get the message out in a refreshed way that appealed to the audience. And we had over 6.7 million impressions delivered in less than 6 months, leading to over 500,000 clicks directly to the website from those, and over 3.5 million social media reached, almost double the average of click-through rates and video streamings to completion. So those were that we can see, and we wanted to share that with you. Hopefully you've seen some of these, but if you haven't, we wanted to make sure that you have and get the message out. We have a new website to go along with it, and it was 3 scheduled release phases with digital ads to mirror social media designs, video and audio spots, and also all was translated into Spanish. Next. So this is our one of our general PSAs in relation to the preparing for a lifetime.
The choices you make before, during, and after pregnancy can have a big impact on the rest of your baby's life. Maybe an astronaut, a doctor, or a ballerina. But right now, it's the little moments that will make the big moments possible. It's more than just one moment. You're preparing for a lifetime. Find tips to keep your baby safe and healthy at preparingforalifetime.com.
So that we call those our doodle babies. That's really getting to the essence of what we're trying to do, is show that it's really about preparing for a lifetime, the lifetime of your child and the child and the family together, and getting to go beyond that first birthday and beyond to see what they're going to be as they mature through life. Next. These are some of the media posts that were designed to go with it. So I just wanted to show you further. So in addition to the PSAs, there were our doodle babies, and then it shows different tips and items were through carousels and social media. For example, this one's your decisions before, during, and after pregnancy can have lasting impacts on your baby's health. The good news is you don't have to navigate this alone. We're here to help. Next. So the continuation of phase 1, giving your baby the best start, saying you're doing great, mom and dad, but knowing what to do with your new baby can be confusing and hard. And then kind of giving the message and getting them to click through to get the information to be able to continue healthy pregnancy and birth and infancy. Moving forward. Another example of this one's particularly during pregnancy. So it gives helpful hints and then directs to the website for further information. Next. This one is particularly in relation to maternal mood disorders and postpartum depression, really kind of letting them know that, you know, they're not alone. It's okay to ask for help, knowing what to do next, and you can click through and then get information, services, and more information in relation to. Next. And this one is further in giving your baby the best start. So kind of preventing premature birth, breastfeeding tips, and also it gives further information. Again, when you go to the website, you get further details. Next. And again, so this is another one of the ads that went out, letting them know decisions can have lasting impacts on your baby's health throughout their lifetime. And this one is another one in that regard. Next. This is the new website that's been designed to go along with it. So when they click through to the website or when they go to the website directly, it's modeled after it, and then kind of has the 3 main areas of maternal health before, during, and after pregnancy, baby's health, and safety. Creating safe moments are kind of the 3 main buckets, and all the work groups are included in there. And yes, we love our doodle babies too, Barbara, so thank you. And then we wanted to give a special call out to dads and caregivers. So we know dads and grandparents and others also are taking care of baby and mom and the family. And so there's resources for them also, including the new grandparents toolkit and other resources that you can click through there. Next. So I'm just going to finish with some of our doodle babies that are helping draw information to the information that you all are helping us provide and getting that information out on reducing infant mortality and improving maternal and infant health outcomes. And so you're going to see 3 doodle babies. We'll start with Ballerina.
The small choices you make before and after your baby is born can have a big impact on the rest of their life. It's more than just one moment. You're preparing for a lifetime. To learn more, visit preparingforalifetime.com.
And then we have our astronaut.
The small choices you make before and after your baby is born can have a big impact on the rest of their life. It's more than just one moment. You're preparing for a lifetime. To learn more, visit preparingforalifetime.com.
Doctor.
The small choices you make before and after your baby is born can have a big impact on the rest of their life. It's more than just one moment. You're preparing for a lifetime. To learn more, visit preparingforalifetime.com.
So that is kind of our update for today. And I hope you enjoyed the new refresh for Preparing for a Lifetime. And I hope you're seeing those different ads and PSAs as they're out there right now. We also love any feedback at any time. Please provide that to us. Preparingforalifetime.com is the website. So please feel free to go at any time. And like I said, we are happy to take any input or feedback in relation to the initiative and to the ads that are out there. We appreciate you all and thank you. If there's any questions, I'm happy to take those at this time.
Thank you, Joyce. I love the
All right,
doodle
thank you.
babies. And I have seen them on social media.
Great.
Are there any other questions or comments? We'll be on the lookout for the doodle babies. And I'll have to take a look at that grandparents toolkit and provide the information to our new grandbaby coming in November. So
Congratulations.
I'll make sure we look at all of these websites. So thanks, Joyce. We appreciate the updates. And now with updates from the Oklahoma Healthcare Authority is Falaki Adedije. I don't know if I pronounced your last name correctly, Falaki. I'm sorry if I didn't.
Oh, no, you did good.
Okay.
Hi, everyone. And honestly, I'll take someone trying over someone saying they just don't want to try. So that's always a winner in my book. Hi, everyone. I have a couple of updates since the last time we met. Yes, and yes, congratulations, Barbara, on the baby that's coming. You'll have to share baby pictures. So as I was saying,
so we will.
Okay. So last time I was here, I kind of talked to you about a CMS funding opportunity that we were trying. I don't know if we had decided to apply for it at that point, but I know I talked about it a little bit. We did decide to go ahead and apply for it, and we have a lot of partners on the call today, and I haven't had a chance to say thank you to everyone who was a part of that because it was really a rather heavy lift, but as a group, we got it done and we got it submitted September 20th. And we got notice from CMS that they had pulled down our application and we're currently reviewing it. We hope to hear back from CMS towards the end of December to see if we've been awarded or not, but we'll be we will definitely keep everyone posted. It's one that we're excited about because we think we can do a lot of great work um, with it. Um, Also, I wanted to kind of put this on everyone's radar. So, OHCA in our managed care program that we're currently working to set up, we've been working with the health plans to design their value-based arrangements. So in their contracts or in the health plan contracts, and this is both dental and medical, but more medical, there was stipulation that the health plans had to enter into value-based arrangements or value-based payment arrangements with providers. And there were some measures in the contract that if um, if the plans and their contracted provider partners didn't hit targets on those measures, their quality measures, and I can make those measures available to anyone who wants to know what those withhold measures are. So if the plans and the contracted providers didn't hit targets on those measures, we would be withholding, I think, up to 1.5% of their cap payment. And so that's supposed to hit January 1st, 2025. And so we've been working with the plans to understand how they want to implement that, how they plan to support providers, both urban and rural areas. And so there's been a little bit of back and forth to understanding the methodology and just how they want to operationalize the plans that they've turned into us. We're hoping to approve their plans this week. This has been about a 6 week process to where they would submit something, would have questions, would meet, and it's been, an iterative process and back and forth, and it's getting clearer and clearer with the questions that we're asking. And we feel confident that we should be able to approve those plans before this week runs out. And like I said, those arrangements will go into play January 1st, 2025. One of the reasons why the plans are so eager to get the approval is so that they can begin to outreach providers and communicate with health systems to kind of, keep them in the know of what's coming down the pike, although a lot of people already know. Um, Another update that we have is we're currently in the process of redesigning our patient-centered medical home model. So when we moved a lot of our populations to managed care, one of the things that we realized or we noticed after we had moved several people over was that we didn't have as many American Indians and Alaskan Natives and tribal members move over to Sinai. So we still have a fairly large population of tribal members, as well as our ABD population and some other populations that we never intended to move over to managed care. And so because the population that we've kept behind looks very different from what we used to have a year, 2 years ago, it's come to, our attention that we need to redesign what the patient-centered medical home model looks like to better fit and suit the population that's staying behind. And so work has started on that, and the groups are meeting or initially internally to kind of walk through what some of those elements are, and then we will have external stakeholder meetings to kind of present what we're thinking about and how we're thinking about it, and have external partners speak into the redesign process. And then last time I was here, we also talked about Senate Bill 1739. And at that point, we had just received internal approval to pull the work group together and start to walk through what reimbursing birth centers would look like, reimbursing what midwives would look like, and reimbursing what certified professional midwives would look like. I'm happy to report that that has moved forward. We now, I think, have a work group, and they're working diligently to answer all those questions so that we can make rules concerning that. Those are all the updates that I have. If anyone has any questions, I'll be happy to answer.
Thank you, Falake. Are there any questions for Falaki?
Alaki, this is Jill Nobles-Botkin, and I have a question about the MCOs, and
Mhm.
I don't know if you can answer this, but contracting with providers that are just outside of the state lines. We've had some issues come up again where our prenatal clients can't get care because the closest hospital is across the state lines. And I don't know if we have a list of providers that are contracted anywhere that we can help some of our counties with, or I know that there's a lot of work being done on this, probably behind the scenes that I'm not aware of, but
So, this is Becca Gossett and
oh, hi,
PCN
Becca.
for hi for the Healthcare Authority. I think I can probably help with this. So, um, the state law right now says that 50 miles surrounding the border of Oklahoma, those facilities are considered in-state providers. That being said, if a facility is outside of 50 miles from the border of Oklahoma, it does require prior authorization. Okay, so we do recognize that down in the southeast part of the state and then around the panhandle that becomes a little tricky, right? But
You
that
hit the
being
two
said,
places that we're having.
yeah, I know.
I'm not surprised.
I work on that daily. So, that being said, if there are individuals that are having concerted efforts, or the other thing that I will say, let me see the chat. If providers are having problems, let me get the email address. If providers are having problems um, with any like access to care issues, anything like that, we have, a Sooner Select team, ca.org. And I am recommending that they can email this team and then they connect with the CEs directly to help them work through those member issues, provider issues, and there is quick resolution. Now, if it is a member that was on Sooner Care Choice and then recently, within the last 90 days, transitioned to one of our CEs, then that is a member issue that I am able to help with because it's still in that transition of care period. But once it goes outside that 90 days, we have to go through the Sooner Select team. Okay.
And as I understand it from our conversation, if they're on soon to be Sooners, if they're covered by soon to be Sooners, that's not an issue. It's just with the MCOs, right?
The soon-to-be Sooners are still covered by my unit. That is Sooner Care Choice, right? So that would be we manage, OHCA manages their benefits.
Okay, just some things I learned this week. So I just wanted to clarify for somebody, the other people in this
Right.
in this meeting that might have those same questions. So thank you.
So yeah, no, that's fine. So anyone that is age blind and disabled, and so you would think, are there disabled folks that are pregnant? And the answer is yes, right? Because there are different disability determinations. And then someone who is tribal has the ability to opt out of the Sooner Select population. If they opt out, they cannot opt back in to a choice, like a Sooner Select plan until the next enrollment period. So if they opt out, it is a once a year opt out. So the tribal uptake for this first plan year was pretty low. I think that they are trying to see, maybe how everyone else is doing, and then maybe see. Now the dental, they did opt in. Quite a few of them opted in for the dental care, but they are still wanting to have their medical benefits managed by a senior care choice or an IHS facility. So it's just their right. So, but I would
Thank you.
encourage any provider that is having issues with Sooner Select to email that email address, because we have a whole team of people that really are helping to resolve those issues very quickly. And that includes billing issues, anything like that. Okay.
Thank you, Becca.
Welcome.
Thank you, Becca. We can put that in our follow-up email so that people have that information. Becca, thank you. Okay. I have a couple of updates that I'm going to do right now because I wanted to get them done up front towards the front of the meeting. And then we have a brief presentation from Tulsa Birth Equity Initiative. And then I'll provide a few other updates at the end of our meeting. So our first update, you all have probably heard that we have transitioned to the Oklahoma Hospital Association effective October 1st. So please note that our emails have all changed. They are just our first name at OKOHA.com. And we're excited for this change and the ability to be a little more flexible and nimble with our work. So more to come on that. And our next update, just wanted to make sure everyone knows that our annual summit will be held Tuesday, November 19th at the Oklahoma City Convention Center. Because we are with OHA, we are having a pre-conference for their annual convention called Connect 24, which will be held on that Wednesday and Thursday. So ours is on Tuesday. It's at the Oklahoma City Convention Center. Our registration is open, so please go to our website to register. There is no cost to the convention, and we're very excited to have Nancy Byatt as our featured speaker, who is a perinatal psychiatrist and the executive director for Lifelines for Families and Lifelines for Mom, and her area of expertise is perinatal mental health. So we hope that you all will join. We'll have a presentation on teen birth and our final research data. We will be submitting a manuscript for that. And Amber Weiseth will be here to present on that and some other topics for our summit on October 19th. So we look forward, not October, sorry, November 19th, coming up in about a month. So we look forward to seeing you all soon. And hopefully you also will decide to register for Connect 24 for the Hospital Association Convention. There's a lot of exciting speakers at that meeting as well. So next, I'm very happy to have Omari Jimerson, who's the executive director of the Oklahoma Birth Equity Initiative, and I'll let her make her announcement and provide you all with some updates on the 5 years that TBEI has been existent. So thanks, Omari, for being here this evening.
Thank you, Barbara. I am actually super excited because the logo was not showing on my side and I was freaking out. I was like, that's the whole moment. So last week we announced at our 5-year celebration that we are no longer the Tulsa Birth Equity Initiative, but now the Oklahoma Birth Equity Initiative, equipping families to have healthy births with dignity and to reduce maternal health disparity. And so what does that mean? I've gotten a lot of questions. Does that mean that you guys are going to be having doulas all across the state working for you? Well, yes and no. So we have been getting, and this was kind of leading up to doula reimbursement coming down the pipe. We've been getting a lot of questions about our training. Next slide. and how we can, next slide, Barbara, how we can make our services available across the state. So just some fun picks on our community-based doula training. Next slide. So the exciting news about our training is we have been working in partnership with an organization based out of San Francisco called Sister Web to design a doula training that is modular based and can be moved into different communities and ebb and flow with what they're looking for. So it'll be based on specific core competencies that it takes to be qualified as a doula. But for example, in the current training that we were doing, we're actually in the midst of piloting this model. There was nothing that was specific to the Native population, which is a big deal here in Oklahoma. And so there are different, I'm actually driving in the car right now with one of the trainers who's been super excited and reporting back all the great news of what's going on in the pilot. But there are things in there about diversity, equity, and inclusion, just a lot of it's more encompassing than what we've done in the past. The training has been piloted in San Francisco. And what I mean by modular, an example is in San Francisco, when they piloted, they did the 60 hours over 2 weekends. Whereas when we're doing it, we're continuing to stick with our model of 10 weeks. So meeting twice a week over a 10-week period for 3 hours each session. And it just shows how it can be nimble to fit into different communities and fit their needs. So what we want to do, or what we're aiming to do, is take this training out, and the grant that Malaka was just talking about is one that we hope will be able to support this work. But taking it out, targeting communities that are in our maternal health deserts, and then what OPQIC would do is we would be responsible for holding the certifications of those that have used our training in the state of Oklahoma. And there's just a little bit more of information there about what it looks like to be on the pathway to certification as it stands right now. But the second piece of this that we will be rolling out in January is an apprenticeship program. So anyone in Tulsa, at least for now, will be able to follow and shadow our full-time doula, so they get the full wraparound experience. So the first part of it is the training and the learning part, and then the second piece of their certification, because right now they're required to go out and get their observations apart from us. And so they'll be able to fulfill all of those certification requirements while going through our apprenticeship program. So we're super excited about that. They actually had a conversation with our cohorts last night, and pretty much everyone, because we didn't make it mandatory for this cohort when we were going through the interview process, this one will kind of be a self-select, but almost 100% of the class was interested in continuing on to do the shadowing. So we're super excited about that. Next slide. So one of the things that we released last week was our 5-year impact report. And in that, there is a section that speaks to our goals. We haven't to date had public facing goals for the community. And so this just kind of gives you an idea of what our universal goals, and universal goals apply to all maternal health. So for example, that first one says eliminate maternal and infant health disparities in Oklahoma. As everybody is here on this call, we're here to work ourselves out of a job. But at the same time, I'd like to jump down to the third bullet where it talks about bringing joy back into birth. I think a lot of times we get so stuck on the disparities, which is the why behind what we do, that a lot of women now are ashamed to talk about their story if it is a joyful story. And so I think we need to get back to focusing on the joy that comes with birth. And in our strategic goals, we're digging deeper into those populations that have the highest disparities. You'll see in 5 years, we hope to increase the number of Black birthing people utilizing culturally competent doula services by 10%. And that's across the state. So that means we got to get busy with these trainings, while also partnering and working to increase the number of certified midwives and diversifying what that looks like across our state. Um, and Barbara, next slide. So something else we talked about in our presentation or in our impact report was our reflections and wins. And I'll just call out that that baby right now is 11 years old. That's me and my youngest. Next slide. It's something funky with the font there.
I'm in this meeting.
Some of the data points that I think are important to call out in Tulsa County, Black women who have been served by TBI have nearly the same preterm birth rate as white women in Tulsa County. So that just speaks to the work that is being done. And when we drill down into those disparities, we can affect major change. And so just really excited to see what that continues to look like over time. Another one to call out on this slide is our cesarean rates in comparison to Tulsa County. And then some of you may have heard in times past, low birth rate for Black women served by TBI is close to being half of what it is for the rest of Tulsa County. So we're just super excited that we're just getting started and seeing these promising results already. And then the last slide just pretty much solidifies what I've been talking about, is that OPQIC makes a difference.
Thank you so much, Omari. It does make a difference, and we have seen that and felt it over, looking at the state level, but I know that your clients are the ones that have really felt it, and we are so excited about the future, the next 5 years. And I know you have a lot of potential partners on this call. So we appreciate your work and your leadership, Omari. Thank you so much.
Thanks, Barbara, for the opportunity.
And they do have an impact report available if anyone is interested in reading that.
It's actually linked on our website under the About Us tab, but I can also send you the digital link, Barbara, that you can put in your notes.
Okay, that'd be great. We'll do that. Thank you so much, Omari. Okay, a few other updates from OPQIC we wanted to make sure you all were aware about. We did submit an application to Choosing Childbirth. We'll find out, I guess, here, hopefully in a couple of weeks, whether we are awarded for that. And our work was to support the statewide implementation of the 2 AIM bundles here. One is care for pregnant and postpartum people with substance use disorder, and also the AIM bundle for those with perinatal mental health conditions. So we will let you know about the results of that. And Falaki was provided an update on the TMA, the Transforming Maternal Health application. And I just want to say in Oklahoma, we had a team that began working on this, back in, I think even April, when we knew that this was coming out. And we have a team of lots of different people to come together to work on this. And I think I just have to say thank you to those that were on this team in Oklahoma. This is very unique that we have a team that works together at the state level. Many states that I've talked to, they chose not to apply because it was just too much of an ask to do that. And they didn't even get together. To get a team together was too much of a barrier for them. So just have to say thank you to all of you all here that are partners, and that we have such a great team that works so well together. So thank you. And a couple of other updates. We have just launched 2 weeks ago, I guess almost now, 2 more hospitals for teen birth. We have our last cohort of hospitals, Weatherford Regional and Great Plains Regional Medical Center launched teen birth on October 3rd. And then we have these 5 additional hospitals that are coming up either later this year or early next year in 2025. We have one hospital that has not planned on implementing teen birth, but I'm not going to give up. So we're still continuing to try to get all 43 of our birthing hospitals. But over the first few months of 2025, we will have 42 out of our 43 hospitals that have implemented teen birth. So come to our summit on November 19th, and you'll hear all of the data about the first 4 cohorts that were able to participate in the research component. So thank you to all of these hospitals that are working so hard on this. I'm going to turn it over to Evelyn Radischel to provide a couple of other talk about some other updates.
Thank you, Barbara. So I just wanted to share a couple of upcoming events that are related to perinatal substance use and mental health. The Center for Healthcare Strategies will be putting on a webinar on October 30th for improving health outcomes for pregnant and postpartum individuals. And I am putting the link in the chat so that you can click on that to register if you're interested. It's just a kind of a lunch hour webinar presentation. Next. The next event, or this is actually a 3-day conference, the Momentum Conference put on by the Oklahoma Department of Mental Health and Substance Abuse Services. This will be in December 4th, 5th, and 6th. And excuse me, my voice is going. Lots of opportunity to engage with leaders and people across the state, helping us figure out how we can reduce suicide and substance abuse rates and improve mental health in the state of Oklahoma. So I will put that link in the chat as well. And the last thing I wanted to share, for those of you who attended or who weren't able to attend, I should say, our Nurturing Recovery Maternal Substance Use and Trauma Informed Care webinar series. We have now added that to our website under our initiative for substance use, and you can I'll put that link in here as well. And so you'll just go to where it says Nurturing Recovery Webinars, and you'll see each of the 4 parts that you can watch those videos as well. Very, very informative. We had some great expert panels that provided information. So hope you take the time to review those. And that's all I have for right now. Thank you.
Thanks, Evelyn. Yes, I would encourage you all to share the information about the Nurturing Recovery webinar. There were some excellent topics and just a really good way to sit down while you're eating lunch at your desk and send to your providers, particularly the one about equitable toxicology and testing of birthing people could be very informative for them. So I encourage everyone to take a look at these webinars. And another event that's coming up, I will let Katie Morgan talk about that.
Thank you very much, Barbara. So speaking of webinars, so we just recently had a webinar on addressing the syphilis crisis in Oklahoma. They're going to be doing an in-person provider call to action workshop where dinner is provided in the Tulsa area. So I put the link to the chat that you guys can sign up for that. Dinner will be provided. CEs are offered. The conference or the webinar we just had online pretty soon. Please keep an eye on the OPQIC website. We will have a page there for congenital syphilis, and that webinar and all of the resources that the Oklahoma State Department of Health is developing will be on that website as well.
Thank you, Katie. lots of resources for you all. And another one, I'll let Melissa Ward talk about.
Hi, everybody. So yes, I've been working on our low dose aspirin in pregnancy initiative across the state to reduce rates of prematurity and preeclampsia in Oklahoma. Of course, you may know if you've been on this call before that OPQIC worked with OSDH and the George Kaiser Family Foundation to build this toolkit to improve quality improvement efforts in clinics and in health systems to improve not only that quality improvement work within the provider's office, but also improve patient education and understanding of low dose aspirin. I've met with dozens of groups across the state to educate people that may be doctors, midwives, community birth workers, different patient groups to discuss this initiative and why it's so important that we focus on just something as simple as taking a low dose aspirin during pregnancy. I have included the link on here to our resources at opqic.org/LDA. If you would like me to come and present to any of your groups, I would be happy to do that. My email is right there. I'm excited to share that some of our campaign materials were featured in the newly launched American Heart Association Hypertension and Pregnancy Change Package, which is a huge comprehensive package on how to address not only prophylactic use of aspirin to reduce rates of preeclampsia and related complications, but also postpartum counseling on long-term cardiovascular risk. That's one thing that has been really lacking in the community. So a lot of times people think, well, if I get preeclampsia, I don't really have to worry about it again because it only happens during pregnancy. But unfortunately, it can increase your risk of developing cardiovascular disease and other health conditions as well. So I will include the link in the slides as well when you receive those. And then finally, our social media campaign has also been going out across the state. So far, we've reached 914,000 Oklahoma women between the ages of 18 and 50. So we're getting close to 1 million. So that's exciting. Hopefully we really start to see those impacts take shape across the state as we start getting data from 2024 into 2025. So thank you so much.
Thank you, Melissa. And also, our materials were featured in, what was the A Million Hearts campaign?
Yes, that's part of the AHA Hypertension and Pregnancy Change Package. Yeah.
Okay. Great. Well, I want to say thank you to Melissa for doing such a great job with that toolkit. So please, there's lots of great resources for you to use as providers and with your patients. So there's posters and all sorts of different things. So please go to the website, check out the resources, and we're able to send those to you or come talk to any group. Any other questions from you all? Do you have any other issues or things that you want to address? I do want to mention we've heard today, and I know recently, there is an IV fluid shortage due to the Baxter plant that was damaged during Hurricane Helene. So if you are having any issues, please let us know. And we're working with the Oklahoma Hospital Association to try to ensure that that people have a plan for what to do. And if hospitals need to help each other out, that we can help hospitals work together. So please spread the word if you're feeling that, feeling some IV fluid shortages related to the Baxter plant, the Baxter fluid shortage. Any questions from others? Well, we thank you all for being here today. We will be sending out a follow-up email with the link to the recording and the slides and the links that we had in the chat. For future meetings, the best thing to do is go ahead and register for all of the upcoming quarterly meetings. So that way you can, if we're having problems sending out emails, you will not be affected. So please sign up for that so you will get that quarterly Outlook meeting invite that will be placed on your calendar. Our next meeting will be January 21st, right before the legislative session, and again then April 15th during the session. If you have any topics that you'd like us to include, please send us an email. And in the meantime, we hope that you all will join us at our upcoming events. We have that we mentioned the November 7th congenital syphilis webinar in Tulsa and our summit. We hope to see all of you on November 19th at the Oklahoma City Convention Center. So if we don't see you before then, I hope everyone has a great holiday season. Got lots of holidays coming up before our next meeting in January. So thank you all for all of your work that you do to improve the health for mothers and newborns in Oklahoma. Have a great rest of your evening, I should say. I read somebody's chat. Have a great rest of your evening. Thanks, everyone.
Thanks, everybody.